In this lecture, we will study the important points of the female reproductive system as well as male reproductive system. Now, the first and foremost important point is that the breast atrophy in the young female occurs due to the estrogen and progesterone deficiency, whereas in the postmenopausal female, only estrogen is responsible. So this is the differentiating point, that if an MCQ comes that what is the cause of breast atrophy in the postmenopausal women, that is estrogen only, whereas in the young it is both estrogen and progesterone. Now the tumor which produces estrogen is granulosa cell tumor. ठीक है, थीका सेल ट्यूमर भी प्रोड्यूस करता है बट नॉट इन दैट अमाउंट कि जितना ग्रेनुलोसा सेल ट्यूमर बनाता है एस्ट्रोजन. नाउ इन मेनोपॉज the ovaries basically degenerate and they don't produce the estrogen enough to cause the negative feedback on the gonadotropin releasing hormone and FSH and LH, and as a result there is decreased estrogen and increased FSH and LH. Now in pregnancy there is shortness of breath. Now what is the reason for the shortness of breath? Two basic reasons that are जैसे जैसे यूट्रस का साइज बड़ा होगा it will push the diaphragm up and as a result lungs को उतनी space नहीं मिलेगी expand होने की, so there will be shortness of breath. And the progesterone, it causes the rapid breathing. Its function is that it causes the rapid breathing. So these two factors which will cause the shortness of the breath in pregnancy. Now at puberty what happens that there is a pulsatile release of gonadotropin releasing hormone, and it will further lead to the pulsatile release of the FSH and LH, which will cause the release of testosterone in males to cause the secondary sexual characters, and the estrogen and progesterone in the female. So if there is amenorrhea with high FSH, now what does that mean? कि सेक्स हार्मोन्स तो नॉर्मली प्रोड्यूस हो रहे हैं, मतलब GnRH हाइपोथैलेमस से नॉर्मल प्रोड्यूस हो रहा है एंड इट इज़ कॉजिंग द नॉर्मल रिलीज ऑफ FSH एंड LH, बट आगे से ओवरी रिस्पॉन्ड नहीं कर रहा. जब ओवरी रिस्पॉन्ड नहीं करेगा तो FSH खुद ही हाई हो जाएगा. ठीक है, तो इफ़ देयर इज़ अ पिक्चर विद amenorrhea एंड हाई FSH इट मीन्स दैट देयर इज़ ओवेरियन फेलियर. बट इफ देयर इज amenorrhea एंड लो FSH, इसका मतलब है कि हार्मोन ही इनफ सिक्रीट नहीं हो रहा पिट्यूटरी से. So in this picture the cause of the amenorrhea will be ovarian failure, whereas in the amenorrhea with low FSH the cause of this amenorrhea will be hypothalamus or the pituitary, because not enough FSH is being released from the pituitary. Now if there is now what is the cause of the amenorrhea during the lactation? It is the release of prolactin, and prolactin further has the negative feedback effect on the GnRH. ठीक है, जब prolactin ज़्यादा होगा GnRH कम हो जाएगा, FSH LH खुद ही कम हो जाएगा, तो वो ovulation वगैरह नहीं करवाएगा. ठीक है, तो there will be amenorrhea during the lactation. Now as we know that estrogen has effects on the breast, it has effects on the uterus, it has effect on the cervix as well. Uterus में भी proliferation कराता है, breast की development में भी, and in the cervix it causes the hyperplasia. So cervical hyperplasia is due to the increased estrogenic stimulation. Now we studied that the most important function of the HCG is that it prevents the involution of the corpus luteum till the 8th week of pregnancy, and after that because we need progesterone which is produced from the corpus luteum, and after the 8th week placenta खुद बनाने लग जाता है progesterone, तो corpus luteum degenerate हो जाता है. Now as we all know that the function of the follicle stimulating hormone, as its name suggests, it before ovulation the maturation of the follicles is by follicular stimulating hormone. नाम ही उसका बता रहा है कि उसका काम ही follicles की development and maturation है. Now what is the mechanism of action of progesterone in the contraceptive pills? Progesterone के जब हमने functions पढ़े थे तो उसमें ये भी था कि thickening of the cervical mucus करवा देता है. ठीक है, and बहुत सारे जो बाकी थे हमारे secretory phase वगैरह करवाता है, but if we use them in the contraceptive pills तो हम इसका मेन जो बेसिक फंक्शन जिससे ये प्रेगनेंसी को प्रिवेंट कर रहा है या तो वो क्या है, वो इनहिबिट ओवुलेशन है। वो थिकनिंग ऑफ सर्वाइकल म्यूकस या अगर कुछ और आ जाए तो उससे कंफ्यूज नहीं होना, बस ये पता होना चाहिए कि अगर कॉन्ट्रासेप्टिव पिल्स में दे रहे हैं ना तो इसका जो बेसिक मैकेनिज्म है वो ये ओवुलेशन को इनहिबिट करा रहा है, ठीक है। नाउ दिस इज वेरी इंपॉर्टेंट, द लेबर इज इनिशिएटेड बाय द फीटल ACTH। नाउ फीटल ACTH जो है वो आपका फीटल ACTH आपका रिलीज हो रहा है पिट्यूटरी से। सो फीटल पिट्यूटरी इज इंपॉर्टेंट फॉर द लेबर एंड फीटल ACTH इज इंपॉर्टेंट फॉर द इनिशिएशन ऑफ लेबर। Now, estrogen does not cause the increased risk of ovarian carcinoma. Estrogen can cause the breast CA, but it is the only ovarian carcinoma which cannot be caused by the increased estrogen. ठीक है। In late pregnancy, uterus is most sensitive to oxytocin. ठीक है। Now in the late pregnancy, इसके receptors uterus में ज़्यादा होते जाते हैं तो ये ज़्यादा sensitive हो जाता है। Now the menopause, what happens in the menopause, the estrogen is not enough produced by the ovary and as a result negative feedback on the gonadotrophin releasing hormone as that the FSH and LH is decreased, so increased FSH and LH and decreased estrogen in the menopause. So as this is like this, labor is initiated by the fetal ACTH, so parturition is caused by the fetal cortisol. Cortisol increases the oxytocin receptors on the uterus and enhances the progesterone degradation. So this is the mechanism by which the fetal cortisol is helping. It is progesterone जो था वो basically uterus की contractions को कम कर देता है, ठीक है। और pregnancy, progesterone is the pregnancy helping hormone, तो fetal cortisol इस हार्मोन की ब्रेकडाउन करना शुरू कर देगा और ऑक्सीटोसिन के रिसेप्टर ज़्यादा कर देगा ताकि यूट्रस ज़्यादा कॉन्ट्रैक्ट करे and expel the baby out. Now we studied in the start of this reproductive lecture that both the decidua parietalis and capsularis, when they meet together, there is obliteration of the uterine cavity. Let me check if I can show you the So this is the decidua parietalis and this is the decidua capsularis. As the fetus is growing, this is the uterine cavity, white in color. As the fetus is growing, this decidua capsularis is moving towards the decidua parietalis, and when these two will meet together, the uterine cavity will be obliterated. So this is what is said in that MCQ. Now the histology of vagina is that it is containing a lot of elastic fibers because it has to be elastic for its function, ठीक है। Now the which contraception has a failure rate of less than 5%? This is most repeated MCQ and the answers in the in the CPSP keys is that it is IUCD. So you just need to rectify it because in reality its actual rate is less than 1%. ठीक है। तो whenever there is an MCQ in which there is a contraception failure rate is less than 5%, that is IUCD. See in this part 1 exam sometimes you have to rectify a few things because there is no concept behind it and we cannot do anything, and these MCQs really come in the exam. There are 2 to 3 MCQs which have no reason and no logic and you just have to remember it. So the next is the postmenopausal woman comes with a bone pain. You have to give her the SERM. Now SERM is the selective estrogen receptor modulator. Basically ये होता क्या है SERM? SERM is a special synthetically made drugs which will be having a agonist effect on the few organs whereas no effect on the other. जैसे कि estrogen can cause the breast CA, ठीक है। तो if there is a postmenopausal woman, अगर हम उसको bone pain हो रहे हैं, as we know कि एस्ट्रोजन डेफिशिएंसी की वजह से ऑस्टियोब्लास्टिक एक्टिविटी कम हो जाती है, ऑस्टियोक्लास्टिक एक्टिविटी ज़्यादा हो जाती है, तो उस वजह से उसको बोन पेन्स हो रहे हैं और अगर हम इसको नॉर्मल एस्ट्रोजन देना शुरू कर दें तो इट कैन कॉज द ब्रेस्ट सी इन दैट वुमेन. So we have to give her a selective estrogen receptor modulator which will have the agonist effect on the bone cell receptors, whereas it will have no effect or antagonist effect on the breast tissue. So there is a protein on the sperm which is the fertilin, which attaches the sperm to the ovum. This is an important thing. ठीक है, fertilin protein on the sperm attaches the sperm to the ovum. Now, if a hypertensive pregnant woman comes to you with the preeclampsia or eclampsia and she is given magnesium sulfate and it causes the hypotension. Now, we should know that the magnesium sulfate की जो है ना विंडो वो बहुत नैरो है, मीन्स सेफ्टी इंडेक्स इसका बहुत नैरो है. अगर हम मैग्नीशियम सल्फेट की ज़्यादा डोज कर दें, इट कैन कॉज द कार्डियक फेलियर, इट कैन कॉज द रेस्पिरेटरी डिस्ट्रेस. सो द एंटागनिस्ट और द एंटीडोट ऑफ दिस मैग्नीशियम सल्फेट इज कैल्शियम ग्लूकोनेट. ठीक है, कैल्शियम ग्लूकोनेट भी दिया होता है, कैल्शियम क्लोराइड भी दिया होता है, बट यू डोंट हैव टू confuse it. First choose calcium gluconate, and if it is not in the options, then choose the calcium chloride. So basically 10 ml 10% calcium gluconate is given slowly intravenously. So the decreased incidence of preeclampsia has led to the decreased in maternal and perinatal mortality rate. It is the community medicine question, but you just need to go through it. Now, if a pregnant woman is keeping the pets, the most common infection is the toxoplasmosis, and it is most commonly related to the cats. ठीक है, बिल्लियाँ जिन्होंने रखी होती हैं उनमें ये toxoplasmosis का इन्फेक्शन प्रेग्नेंट फीमेल्स में कॉमन है. Now, if a pregnant female with 20 weeks gestation comes with the bleeding and the passage of the vesicles with raised beta HCG, you know it. Snowstorm appearance on the USG ultrasound, so it is hydatidiform mole. ठीक है. Now, if a mother is pale and lethargic and bleeds heavily during the delivery, it can lead to iron deficiency anemia in both mother and the baby. ठीक है. Now, during the sexual act, the secretion from the vagina are due to the parasympathetic stimulation. Now, there are few points which should be clear, that erection in the male is also due to the parasympathetic stimulation, pelvic nerves S2, S3 and S4. ठीक है. The emission का मतलब है कि जो भी sperms stored थे epididymis में, this epididymis and ductus deferens contracts, and these sperms then move to the posterior urethra. Now, this emission is caused by the sympathetic nervous system. Erection was caused by parasympathetic nervous system, emission is caused by the sympathetic nervous system, and ejaculation is caused by the pudendal nerve. ठीक है. तो you should be knowing कि जो secretions हैं वो most commonly जो है वो parasympathetic से हो रही है फीमेल में, मेल में भी, लेकिन मेल में इरेक्शन भी पैरासिम्पथेटिक से हो रही है. एमिशन जो है मतलब कि एपिडिडिमस से और वॉस डेफरेंस से वो स्पर्म्स जो है वो वॉस डेफरेंस एंड एपिडिडिमस विल कॉन्ट्रैक्ट एंड द स्पर्म्स विल मूव टू द पोस्टीरियर यूरेथ्रा. दैट इज द एमिशन एंड इट इज अकरिंग ड्यू टू द सिंपैथेटिक नर्वस सिस्टम. And in ejaculation visceral and somatic nerves, that is the pudendal nerve, are involved. ठीक है. Now, normal menstrual blood flow is less than 80 ml. ठीक है, normal less than 80 ml होता है, ये पता होना चाहिए. Now, the superficial perineal pouch is attached to the perineal body. ये anatomy का question है and it is wrongly placed into this slide, so we'll just skip it and discuss it in the anatomy. Now, the Detrucer muscles are the muscles of the urinary bladder and they are supplied by the parasympathetic S2, S3 and S4. This came in my exam and I did it wrong. ठीक है, तो you should know that the Detrucer muscles are the muscles of the bladder, urinary bladder, and they are supplied by the parasympathetic S2 and S3 and S4. ठीक है. Levator and eye muscles are supplied by the pudendal nerve, and the muscle which is cut in the episiotomy is bulbospongiosus, very high yield. Remember it as MBBS. Muscle, ठीक है, which is cut in episiotomy is the bulbospongiosus muscle. Now what is the estrogen effect on cervix? Cervical adenosis means कि उसके secretions बनाने वाले जो ducts हैं, जो glands हैं, वो ज़्यादा हो जाते हैं. This is the cervical adenosis. Now if a thalassemia is suspected in the fetus, how do you diagnose it? You diagnose it by chorionic villus sampling. Chorionic villus sampling basically utilizes a catheter or a needle to biopsy the placental cells, ठीक है, that are derived from the same fertilized egg as the fetus. Basically आप chorionic villus sampling में नीडल डाल के प्लेसेंटल सेल्स जो हैं वो एक्सट्रैक्ट कर रहे हैं, एंड देन वी स्टडी द जीनोम. तो उससे हमें पता लग जाता है कि भाई इसमें थैलेसीमिया के चांसेस हैं या नहीं है. One thing that we should know is that the chorionic villus sampling is done between the 10 to 12 weeks of gestation, ठीक है, and amniocentesis, in which a small sample of the fluid that surrounds the fetus is taken and studied. उसमें cells होते हैं amniotic fluid में fetus के, उन cells से हम उनकी genetic study कर लेते हैं. Now chorionic villus sampling is done between 10 to 12 weeks and amniocentesis is done after the 14th week, ठीक है. और इन दोनों के जो साइड इफेक्ट्स हैं, these are the fetal telopace, मतलब के फीटल्स के बच्चे के लोअर लिम्ब के जो पाँव हैं, देयर कैन बी क्लब फुटिंग, ठीक है, क्लब फुट हो सकता है. तो यू शुड नो दैट द if a thalassemia is suspected, chorionic villus sampling is done. It is done between the 10 to 12 weeks, ठीक है, और इसमें हम प्लेसेंटा का थोड़ा सा टिश्यू रिमूव कर लेते हैं नीडल डाल के, and amniocentesis is done after the 14th week, and amniocentesis में amniotic fluid ले लेते हैं और उसमें जो बेबी के सेल्स मौजूद होते हैं, we study that, and amniocentesis is done after the 14th week. Now if there is a uterine prolapse, the most common changes are the chronic cervicitis and the squamous metaplasia. Due to the chronic irritation of the wall of the uterus and the cervix, there is chronic cervicitis, ठीक है, infection of the cervix, and the metaplasia, which is squamous in nature. Now if there is a pregnant lady, ठीक है, what is the indication if there is a pregnant lady whose dilatation and curettage is done, and the surgeon says that her hysterectomy should be done, so what can be the cause? There can be the complex hyperplasia, in which the epithelium is having changes which are leading towards the carcinoma. So complex hyperplasia is the indication for hysterectomy. What is complex hyperplasia? In which the epithelium is undergoing changes which can lead to the carcinoma. Now which change makes it possible for the mother to lactate for the whole year? Lobular hyperplasia. We studied in the breast CA section the breast anatomy, in which the breast is having the lobules and the ducts. The lobules are producing the milk, so when the when the female is pregnant and the body is undergoing the changes, so estrogen and progesterone act and they cause the lobular hyperplasia, and it helps the mother to lactate for the whole year. Now the granulosa cells, as we studied, are in the Graafian follicle. Well, they are also in the primordial follicle, in the secondary follicle, but the Graafian follicle is the fully developed follicle, and the granulosa cells are most abundant in the Graafian follicle. We studied it in the lecture. Now during the pregnancy, there is obliteration of the uterine cavity by the fusion of decidua paritalis and decidua capsularis. I showed you the diagram of it. Now if there is a lady with the pervaginal bleeding and there is a history of bleeding disorder and it has the dead fetus, the first step of management will be blood transfusion, ठीक है, because she can bleed heavily during the procedure of dilatation and curettage. So first step will be the blood transfusion. Now, if there is a woman with polycystic ovarian syndrome, do suspect diabetes mellitus. ठीक है, most commonly diabetes mellitus present in the women with the polycystic ovarian syndrome because there is an end organ resistance of the insulin in PCOS. Now, to see if the fetus is having the growth restriction, we do the Doppler studies during the pregnancy, and if there is increased pulsatility in the uterine arteries, that shows that there is growth restriction in the fetus. So increased pulsatility in the uterine arteries shows the growth restriction on Doppler studies in a pregnant woman. Now this is the MCQ of the anatomy, that what is the contracted pelvis. Now the MCQ comes like, a woman was unable to deliver the baby due to the prominent ischial spine and narrow subpubic angle, and the finger cannot reach the sacral promontory. उसका pelvis इतना टेढ़ा contracted and छोटा है that a finger cannot reach the sacral promontory when examined through the vagina, and the ischial spines are prominent and there is narrow subpubic angle. Think of contracted pelvis. We will study in the anatomy the types of the pelvis. Now, if the female at the gestation age of 34 with fundal height of 28, think of the oligohydramnios, ठीक है, due to the renal agenesis of the baby. The most common cause of oligohydramnios is the renal agenesis of the baby. The most common cause of the premature ovarian failure is the autoimmune disease. Remember it, it's very important. Now the extent of the fallopian tubes is from the fimbria to the superior lateral border of the uterus. We all know it. Now the warty lesion on the vulva is condylomata acuminatum, and it is due to the HPV. Let us study the few lesions. If there is a painful papule on the vulva, it's most commonly due to the herpes simplex virus. ठीक है. If the question is like there is genital wart, it is most commonly due to the HPV and it is condylomata acuminatum. Now if there is a painless ulcer and is present on the vulva, it is most commonly due to the secondary syphilis, and this condition is condylomata lata. So L in the syphilis, L in the condylomata lata, and it is a painless ulcer. I need you to write it down that the painless ulcer is related on the vulva is related to the secondary syphilis, and this condition is condylomata lata. If there is a genital wart, the question is just like the genital wart on the vulva of the female is options are condylomata acuminata, condylomata lata, or the papule. So choose condylomata acuminata because it is the most common. If the question is the painful papule, it is the herpes simplex. If the question is just the genital wart, it is the condylomata acuminata. And if the question is there is a painless ulcer, that is the condylomata lata of the secondary syphilis. Now if there is a painful ulcer, ठीक है, and there is an option of if there is a painful ulcer with the chancroid appearance, that is Haemophilus ducreyi. So ducreyi, painful ulcer. Painless ulcer, syphilis. Painful ulcer, Haemophilus ducreyi, chancroid appearance. ठीक है. Now the woman was nursing the baby for 1 year. There was lobular hyperplasia. We studied it. CA cervix spreads via internal iliac lymph nodes. This repeated for the 100 times. CA cervix spreads via internal iliac lymph nodes. Remember it by heart. This is also the most repeated MCQ. The HCG is detected in the serum in the 9th day of ovulation. See, it is the serum. 9th day of ovulation पे HCG can be detected in the serum. Now the uterus का जो histological epithelium है, the epithelium of uterus is simple columnar, whereas the epithelium of fallopian tube is simple columnar ciliated. ठीक है, cervix का कौन सा epithelium है? Generally simple squamous with cleft and smooth muscle. Endocervix का कौन सा है? Simple simple columnar, whereas ectocervix का stratified squamous epithelium. ठीक है, तो अगर जनरल सर्विक्स की बात हो रही है तो सिंपल स्क्वेमस एपिथेलियम विद क्लेफ्ट एंड स्मूथ मसल. एक्टोसर्विक्स हैज स्ट्रेटिफाइड स्क्वेमस एपिथेलियम, whereas endocervix has simple columnar epithelium. Now, the placenta in the late pregnancy is consisting of the syncytial trophoblast and the fetal endothelium. We studied it. Now, this is very important. Which layer is shed during the menstruation? That is stratum functionalis, and it is composed of stratum compactum and stratum spongiosum. You need to ratify it. Which layer is shed during the menstruation? That is stratum functionalis, and it is composed of stratum compactum and stratum spongiosum. ठीक है, our gynae mentor will discuss it in detail. Now, what is the support of the uterus? Now, it is again the anatomy MCQ. It is the transverse cervical ligament, TCL. The main support of the uterus is transverse cervical ligament. Now, in the later stages of the pregnancy, estrogen and progesterone are produced by placenta. I discussed it in the lecture. Now, there is another MCQ that the calcium requirement in the pregnancy is 1200 milligram. ठीक है, write it down. Now, if there is a facial growth on the chin and the face in a woman, it is hirsutism. Polycystic ovarian syndrome में ये common है along with diabetes. Now, if a female is on the hormone replacement therapy and her sister has a history of the breast CA, she is also at the risk of breast CA. ठीक है, because of BRCA gene maybe. Now, the highest chance to develop the endometrial CA is with complex hyperplasia and atypia. We discussed it. Now, the important in the initiation of the labor is the fetal pituitary. We studied it right now. If the oxytocin is given at the 28 weeks and it's not working, it means there are less receptors in the myometrium. If the histology of the uterus is showing large tortuous glands with the thick smooth muscles and the increased vascularity, it is the late secretory phase, because large tortuous glands occur under the effect of the progesterone, which causes the secretory phase. So if there are large tortuous glands with thick smooth muscles and increased vascularity, think of late secretory phase. Now, if amniocentesis versus the CVS before the 14th week can lead to the increased chance of the fetal telophase, we discussed it. Now, when the human placenta is separated from the uterine wall, what occurs? The rupture of the uterine vessels. The vagina below the hymen drains into the medial group of horizontal superficial inguinal lymph node. तो deep inguinal lymph node तो इसमें involved ही नहीं है, होते ही superficial है. तो superficial inguinal lymph nodes are divided into the horizontal and the vertical lymph nodes, and this medial group of this is the vagina. ठीक है, तो horizontal and the vertical groups हैं superficial inguinal lymph nodes के, and the medial group of horizontal superficial inguinal lymph nodes are involved in the drainage of the vagina. The uterus cancer reaches the labia majora through round ligament. If a patient is having a menstrual cycle of the 32 days, she will ovulate on. Now what you have to do, जब भी इस तरह का क्वेश्चन आए, लास्ट के जो 14 डेज होते हैं ना, वो फिक्स्ड होते हैं मेंस्ट्रुअल साइकिल के. ठीक है, तो आपने क्या करना है कि जितना भी उसका मेंस्ट्रुअल साइकिल का डेज है उसमें से 14 को माइनस कर देना है. द आंसर दैट इज द in this question is 18th day is the day of ovulation. So how to calculate the day of ovulation? Subtract the 14 from the number of days of the menstrual cycle, and that will be the day of ovulation. Ripening of cervix is done by prostaglandin E2. ठीक है. Now if there is a dead fetus, it can lead to the DIC, it can lead to the coagulopathy. So the first step will be evacuation of the uterus. If there is a female who is young and having multiple abortions, think of antiphospholipid antibody syndrome. ठीक है. In pregnancy, mother feels respiratory distress due to decrease in the total lung capacity, और total lung capacity decrease होने की वजह uterus जो है वो आगे से diaphragm को push कर रहा होता है. So ovarian pain is associated with the obturator nerve. That's a question of anatomy, but you should know that the ovarian pain is mediated by the obturator nerve. ठीक है. So what is the complication of the UV prolapse, cervicitis and the metaplasia? We studied it. So if there is a woman with the postcoital and the intermenstrual bleed and her cervix is hypertrophied, we need to do the cervical smear. The concentration of progesterone on the day 21 of a 28-day cycle is 10 nanogram. You need to ratify it. The blood leaving the placenta has how much PO2? 20%. See how much oxygen fetus absorbs. 80% oxygen blood में से fetus absorb कर लेगा, तो blood leaving the placenta has the question is like the blood leaving the placenta. So there is a confusion कि वो blood जो placenta से baby की तरफ जा रहा है या वो blood जो baby से प्लेसेंटा की तरफ आ रहा है. तो जो ब्लड बेबी की तरफ जा रहा है दैट इज गोइंग फ्रॉम द अम्बिलिकल वेन, वेयर जो ब्लड बेबी से बाहर आ रहा है दैट इज कमिंग थ्रू अम्बिलिकल आर्टरीज. देयर आर 2 अम्बिलिकल आर्टरीज एंड देयर इज 1 अम्बिलिकल वेन. अम्बिलिकल आर्टरी हैज ऑक्सीजन सैचुरेशन ऑफ द 55% एंड PO2 ऑफ 22, वेयर अम्बिलिकल वेन has a PO2 of 30 mm. ठीक है, 30 millimeter of mercury. So if the question is like umbilical artery has a PO2, so it is 20, whereas the blood leaving the placenta, I'll discuss it in detail at the end of this lecture. Now the HCG maintains the corpus luteum, we discussed it. The obstructed labor, if there is obstructed labor, there is a use of instruments which can damage the vagina as well as the urinary bladder and can lead to urinary incontinence due to vesico-vaginal fistula. ठीक है. Ovarian CA, as ovary is drained by the para-aortic lymph node, so ovarian CA first metastasizes to the para-aortic lymph node. Now we studied that secondary oocyte undergoes the second reduction division after the fertilization. We studied it in detail. And the primary oocyte is surrounded by the zona granulosa of granulosa cells and zona pellucida, which is the outer of the granulosa cell, and if it is filled by the fluid, so this will be secondary oocyte. So if the primary oocyte surrounded by the granulosa cells and the zona pellucida has the fluid filled cavity, it is the secondary follicle. Now the abdominal contraction is helpful in the second stage of labor. This is also the most repeated MCQ. So the abdominal contraction is helpful in the second stage of the labor. This will be discussed in detail by the gynae people. So the secretion of vagina during the sexual act, parasympathetic stimulation. We also studied the male mechanism as well. So the whip-like movement of the cilia are present in the fallopian tube, and normal menstruation blood is less than 80 ml. It is commonly 35 to 40 ml. Now the complication of the obstructive labor is the vesico-vaginal fistula, which is the fistula between the urinary bladder and the vagina, and can lead to the urinary incontinence. The common cause of subfertility is anovulation. ठीक है, and the common cause of the anovulation is the autoimmune mechanism. Now the patient with the bicornuate uterus has the congenital anomaly of which system? You see paramesonephric issue है, so it will be the urinary system. ठीक है, the failed fusion of the Mullerian duct can lead to bicornuate uterus. You have to remember it. Breast stroma and duct development. ठीक है, we studied it. I explained it in the lecture, the functions of the estrogen and progesterone. So the breast stroma and duct development occurs both by estrogen and progesterone. तो अगर options हो estrogen, progesterone and estrogen plus progesterone, choose both. But if only one of the option is there like estrogen and progesterone, choose estrogen, because estrogen is involved mainly in the duct and the stroma development, and the progesterone is involved in the lobular development. ठीक है. So most common side effect of the IUCD is the menorrhagia or excessive bleed. The epithelium of the endocervix is simple columnar non-ciliated epithelium. ठीक है. The highest concentration of the surfactant in the amniotic fluid is in the last trimester of the pregnancy. Urinary bladder is supplied by the pelvic splanchnic nerves S2, S3 and S4. If the autonomic afferent is cut from the urinary bladder, it can lead to the overflow dribbling. It will be discussed in detail in the anatomy, but you need to know. So if the woman comes with abdominal distension, there is shortness of breath, abdominal mass, ascites and the pleural effusion, it is the Meague syndrome, fibroma, ठीक है, ovarian fibroma, which can lead to ascites, pleural effusion, abdominal mass, Meague syndrome. So what happens? So there is the regression of the uterus and the breast after the pregnancy, and the main function of the lysosomes is to do it because they have the autolytic enzymes. So the intraepithelial lesion of the vulva is the Paget's disease. The poor prognosis in the ductal carcinoma, basically I told you that if there are three negatives, negative HER2/neu, negative ER, estrogen receptor, negative progesterone receptor, it will have the poor prognosis. But if you have to choose between one, choose the HER2/neu. 18-year-old female is a daughter of the mother who has received diethylstilbestrol during the first trimester of the pregnancy, and presents with a foul smelling discharge, growth in the upper third of the vagina. She can have clear cell carcinoma. Now listen, जिन ladies ने अपनी pregnancy में diethylstilbestrol यूज़ किया होता है, उनके बच्चों में अगर वो फीमेल हो तो clear cell carcinoma of the vagina common है. ठीक है. So this is the daughter of this mother, and her mother used this diethylstilbestrol. So in the daughter, this clear cell carcinoma of the vagina has occurred. ठीक है. The posterior relation of the ureter is the common iliac vessels. ठीक है, जहाँ पे common iliac vessel नीचे जाके divide हो जाती है ना, वहाँ पे uterus आगे से गुजर रहा होता है. So the preterm delivery most commonly is due to the bacterial vaginosis. Now what is bacterial vaginosis? It is the infection, ठीक है, it is an abnormal vaginal condition that is characterized by the vaginal discharge, and there is overgrowth of the atypical bacteria. ठीक है. बेसिकली नॉर्मल जो फ्लोरा होता है ना वजाइना का, वो डिस्टर्ब हो जाता है. जो नॉर्मली बैक्टीरिया प्रेजेंट होते हैं वो कम हो जाते हैं, और दूसरे बैक्टीरिया जो हार्मफुल हैं वो ज़्यादा ग्रो कर जाते हैं वजाइना में ड्यू टू द pH डिफरेंस. एज अ रिजल्ट देयर इज़ फाउल स्मेलिंग डिस्चार्ज, क्लू सेल्स एंड इट कैन लीड टू द प्री टर्म डिलीवरी. नाउ द पिनाइल स्क्वेमस सेल इंट्राएपिथेलियम नियोप्लाज्म, ठीक है, पिनाइल स्क्वेमस सेल इंट्राएपिथेलियम नियोप्लाज्म. This treatment is the cause is the phimosis. Phimosis is the inability to retract the skin covering the glands of the penis. ठीक है, तो जिन लोगों में circumcision नहीं होती उनमें squamous cell जो carcinoma of the penis that is common, ठीक है, and it is more common in the person having the phimosis, which is the inability to retract the skin above the glands of the penis. Now प्रीक्लैम्पिया का ट्रिगरिंग फैक्टर क्या है? बेसिकली प्रीक्लैम्पिया की जो पैथोफिजियोलॉजी है वो है यही कि जितने भी वेसल्स होती हैं देयर इज स्पाज्मोटिक कंट्रैक्शन ऑफ द वेसल्स एंड ड्यू टू दैट कंट्रैक्शन द ब्लड फ्लो इज अल्टर्ड एंड इट कैन लीड टू द प्रीक्लैम्पिया. सो एंडोथेलियल अल्टरेशन इज द ट्रिगरिंग फैक्टर फॉर द प्रीक्लैम्पिया. Deep inguinal lymph nodes do not participate in the lymphatic drainage of the cervix. ठीक है, हमने पढ़ा था कि ये superficial है. If a primary gravida is taking the iron tablets, lot of the fresh vegetables and juices, she can have the calcium deficiency. क्योंकि कैल्शियम तो इनमें नहीं है, ठीक है. फॉलिक एसिड भी हो जाएगा फ्रेश वेजिटेबल से एंड आयरन टैबलेट्स तो ऑलरेडी ले रही है, तो शी कैन हैव द कैल्शियम डेफिशिएंसी. Estrogen does not cause the CA gallbladder and does not cause the CA ovary. ठीक है. Indirect cause of the maternal mortality is heart disease. Now we studied it already that the round ligament of the ovary is the analog of the gubernaculum. Leydig cells which produce the testosterone have the high levels of smooth endoplasmic reticulum because smooth endoplasmic reticulum ने प्रोटीन आगे वो बनाना है, तो इस वजह से Leydig cells में smooth endoplasmic reticulum ज़्यादा होगा. Sperms of the men above the 70 years are asthenospermic, means कमज़ोर sperms which have the reduced motility. Now the testicular tumors with all the tumor markers normal is lymphoma. Commonly occurs above the 60 years of age, bilateral testicular swelling, ठीक है, कोई ट्यूमर मार्कर नहीं रेज्ड होगा, ठीक है. Ductus deferens has thick muscular layers, ठीक है, उसने कॉन्ट्रैक्ट करना होता है during the emission, so it has thick muscular layers. Semen male bulk is released from seminal vesicle, ये बहुत इंपॉर्टेंट है. Seminal vesicle produces the main bulk of semen and high in the seminal vesicle secretion is water. We studied it already that in spermatogenesis acrosomal reaction is carried out by lysosome. During the aspiration of the hydrocele, what is not pierced is tunica albuginea. Tunica albuginea basically outer covering of the testis है, जबकि hydrocele तो जो पेरिटोनियम का fold testis के सामने पड़ा होता है उसमें fluid की collection है, so it is not pierced in the tunica albuginea, ठीक है. If the sperms are less than 20 million, ठीक है, तो इसका मतलब है कि नॉर्मल से कम है. तो if the sperm are less than 20 million, ठीक है, it is abnormal. Spermiogenesis is the conversion of spermatids to the spermatozoa. We already studied it. Epididymis drains into the vas deferens. We all know it. So the sperm are stored after the ejaculation in epididymis. We already know it. The sperm produced per day are 120 million. ठीक है. For a person to be fertile, sperm count should be at least 20 million. So ये abnormal होगा अगर 20 से कम है तो, ठीक है. So the total number of the mature sperms is 100 million per ejaculate. नॉर्मल ejaculate जो होता है वो 5 ml का होता है, ठीक है, और 100 मिलियन है एक ejaculate में. इसका मतलब है कि पर ml में 20 मिलियन होंगे. 5 को डिवाइड कर दिया, 100 को डिवाइड कर दिया 5 से, 20 मिलियन पर ml होंगे. 5 ml में 100 मिलियन होंगे, और अगर 20 मिलियन से कम होंगे तो इसका मतलब है कि वो फर्टाइल नहीं है. Now, if a patient with a normal amount of semen production but azoospermia उसमें है, ठीक है, azoospermia क्या होता है? Azoospermia is a condition in which no sperms in the semen, ठीक है, sperm नहीं है semen के अंदर, so it is a defect of the Sertoli cell because they are involved in the maturation and development of the sperm. So another question, Mullerian duct counterpart is Rete-testis cords. I explained you this in the lecture. Leydig cells which produce the testosterone are containing large amount of smooth endoplasmic reticulum which produces the protein, and as a result they have acidophilic cytoplasm, bluish color का. Primary spermatocyte forms 4 sperms. I also told you this. Now the most commonly CA of the prostate occurs in the posterior lobe, and the largest zone of the prostate is peripheral zone. I showed you the picture in the lecture, and the largest lobe of the prostate is lateral lobe. 2 lateral lobes are there. Okay, let me show you the picture. So this is the prostate, this is the anterior lobe, these are the lateral lobes, and this is the middle lobe, and this is posterior lobe. So largest zone is this whole zone of the posterior zone, largest lobe is this lateral lobe, and CA occurs in this posterior lobe, whereas benign prostatic hyperplasia occurs in the median lobe or middle lobe and some part of the lateral lobes. So the transitional zone of the prostate is median lobe, and it enlarges in the benign prostatic hyperplasia. Now sperms are basically stored in the epididymis, they mature and gain motility in the epididymis. So what is the function of epididymis? To store the sperms and to mature them, ठीक है. Androgen binding protein is produced by the Sertoli cell. And what does Leydig cell produce? They produce the testosterone, and they have increased smooth endoplasmic reticulum, and as a result bluish acidophilic cytoplasm.